am Dr. Sridhara, surgical gastroenterologist at Kaveri Hospital, Bengaluru. April 19th of every year is observed as World Liver Day. I wish you all a healthy liver and a healthy life ahead. On this day, I would like to talk about surgical jaundice. What is surgical jaundice? These are the conditions of the liver, biliary tract and the pancreas which are treated by surgical intervention. Unlike there are conditions in liver and biliary tract which are managed by medicines and by other modalities. However, surgical jaundice, otherwise called the obstructive jaundice, is treated mainly surgical intervention. It's a common thing for the patients to go for the natural way of treatment or to take some medicines whenever there is a jaundice is present. But unlike the medical jaundice, these are not treatable by medicines alone. So there has to be a surgical intervention for them to be cured of their conditions. What are the main complaints these people have? People have pain in the upper right side of the abdomen, and they'll have high fever and they will have jaundice. What is that differentiates from the medical jaundice? Most of these patients will have generalized itching all over the body, which will not get relieved by regular anti-allergic medications. This distinguishes medical jaundice or other itching disorders from the surgical jaundice. What are the few investigations that we do? One is after the examination by the surgeon or the consultant, we will do routine investigations like liver function tests, imaging like ultrasound, CT scan or MRI, and then we'll do an endoscopy. Based on these reports, we'll come to a conclusion as to what kind of treatment the patient has to undergo. What are those conditions that has to be managed by surgical method? So it can be some tumors in the liver which can be cancerous or non-cancerous. It can be infective. It can be infective like in pus formation, what we called as an abscess, or it can be from fluid collections which has been there for several years and presenting now, such as hydatid cyst. It can be because of stone disease in the gallbladder or in the biliary tract, what we call as common bile duct, or it can be tumors or stricture, tightening of the terminal biliary tract at the level of pancreas, which can be because of cancer of pancreas also. Sometimes the surgical jaundice can happen after some surgical procedures like cholecystectomy, when there is then injury to the common bile duct, or there has been a little clamping of the biliary tract, or there are some stones in the biliary tract. Even these conditions have to be treated surgically. So I request all of you, whenever there is a suspicion of jaundice, especially associated with fever and pain abdomen, you have to reach out to the consultant near to you and take their advice and follow their treatment. I wish you all a happy and healthy life ahead.